This is one of my colleagues, a registered nurse at one of the state prisons. I was working with another registered nurse in the triage and treatment area. There were 2 beds in the area and the custody officers were approximately 100 feet away. A patient who complained of chest pain needed my attention for most of the morning because he required a detailed assessment. That meant that the nurse working with me had to attend to the other patients who came in. She became upset when I asked her about whether x-rays had been ordered for one of the patients she'd seen. She responded with accusatory statements to the effect that I'd done nothing all morning and that she was fed up working with me. Suddenly, out of her pocket, she grabbed the set of solid brass security keys and threw them at me. And if you've worked in a prison, a set of keys is a serious thing. It usually has a chain, probably weighs 3 pounds. They crashed into the wall behind me and bounced off so hard that they ricocheted onto an empty stainless steel instrument table. The tray then bounced off its frame and crashed to the floor. The custody officers asked what was going on. My coworker walked out quickly, belittling me on her way out. Another nurse had just walked in behind me and had witnessed the entire incident. She too left quickly to avoid being questioned. Immediately afterwards, my supervisor told me that he, quote, didn't want any problems, and instructed me to keep quiet and continue working with the nurse who had thrown the keys at me. Unacceptable.
Unacceptable.
Right.
The other incident I want to share happened to a licensed vocational nurse. She was working in one of the cell blocks giving out medications. One of the prisoners threw a bag of urine and feces at her. The bag broke and she was splattered by its contents. She immediately called for help and the guards responded. Because there was no protocol in place for this type of incident, and believe me, it's not unique, unfortunately, they put her in a plastic jumpsuit that they use for inmates to protect themselves from bodily fluid contact when they're being transported. They escorted her in plain sight of the inmates who jeered and laughed. She was taken to an outside medical facility for treatment and inoculations against bloodborne pathogens. In response to the incident, her manager told her she needed to get back to work and finish giving out her medications. And as far as I know, there's still no protocol for this kind of gassing incident, is what we refer to it as. So what we're asking is for safeguards in our workplaces, including protocols for incidents to prevent workplace violence and to respond to incidents of workplace violence. So we're here for your support and encourage everyone to share their stories and do what we can to promote a safe workplace where we feel safe, where our patients are safe, and where we can practice safely.
That's right.